And we're joined now by Dr. Preeti Malani, who is the Chief Health Officer and Professor of Medicine in the Division of Infectious Diseases at the University of Michigan, joining us once again. Dr. Malani, thank you for being with us today.
Thank you for having me.
Appreciate having you on. How have you been since we last spoke?
I've been great. You know, summer in Michigan, what can you say?
Oh, yeah.
It's been busy, but it's been great.
So, Dr. Malani, we are preparing to return our kids to school in the fall. In just a couple of weeks, they'll be going back to some to in-person learning and some to virtual learning, some to a hybrid situation. And we saw an article today that vaccinations for kids has gone down significantly over the course of the COVID-19 pandemic in relation to June of 2018 and 2019, as people were staying away from their doctor's offices or were apprehensive about going in case they could potentially on the way there or somewhere else that they stopped pick up the COVID-19 virus. For kids returning to school, how critical is it for kids at a young age to get these vaccinations? While we maybe don't see some of these diseases like measles and whooping cough and necessarily spread rampantly much anymore, these vaccinations are still critical for these kids at a young age.
Yeah, absolutely, and I'm glad that you brought this issue up because the focus is so much on COVID, and of course we're worried about COVID, but in the meantime, all the regular health issues are also important to keep track of, and in kids that means getting their routine vaccinations. And this is something that, you know, if you missed your 5-year appointment or your 4-year appointment, you could very easily miss a large number of vaccines that are so important. And then it takes a little bit of effort to get caught up later.
Dr. Malani, as we have continued through this pandemic, we've seen that various needs from the medical end of the spectrum as these people are being treated for COVID-19, as we learn more about how to treat COVID-19. There are different needs that come up in the community, and right now the American Red Cross is urging those who have had COVID-19 and either have recovered or have been diagnosed and were asymptomatic to donate blood specifically for convalescent plasma. For those that are not medically sound, that are not experts in this or don't know how to dissect the research on convalescent plasma and its effect in treating COVID-19. How can convalescent plasma from those that have recovered from COVID-19 potentially help those that have contracted the virus prevent themselves from having severe complications like damage to vital organs?
Yeah, so this is something that is evolving and emerging, and there are research studies that are ongoing, but the idea of convalescent plasma is pretty simple, and it goes back 100 years and more. The plasma component of the blood, so this is like the yellow area of the blood, the part of the blood that has antibodies, is removed, and then it is made sure to be safe, and then given to someone who is ill with COVID-19. And right now, this is being done really in the hospital setting for patients who are critically sick. It's not being done in people that have mild illness, and it's not being done for prevention, although that is one of the many questions that remains. And again, the idea here is that after you have had COVID-19 and recovered, you have produced antibodies that help protect you against reinfection, although that's also something that we don't fully understand. And in this case, by removing the portion of the blood that has those antibodies from someone who has recovered and then giving them to somebody who is ill is felt to be beneficial. And again, these are smaller studies, and these are studies, some of them are coming from China, where their experience is a few months longer than ours. There's a suggestion that this is helpful. And in the clinical setting, we're reserving this for people who are quite ill. We wouldn't want to do it in somebody who has mild illness, although so far it's looked quite safe.
So, Doctor, I watched Pandemic on Netflix, and it was so eye-opening to me. As someone who studies infectious diseases, how concerned are you that we could see this happen again?
Yeah, so Ronnie, I'm concerned that this could happen again, and you know, we hopefully are going to, when as part of the response is building all those systems to help prevent this from happening again. That has to be part of it, not just focused on all the issues that are important at this moment, but rethinking our surveillance, rethinking how we track information, rethinking vaccine development. But absolutely, it could happen again. I certainly hope it doesn't ever happen again. And fortunately, these are things that can be prevented with careful planning and surveillance.
So one thing that has come out of this is the collaboration across countries, across medical communities, in trying to get a vaccine. Do you think we need to continue that work going forward? And have you ever seen anything like that before?
No, I don't think anyone's ever seen anything like this before. And I think this is one of the silver linings of the pandemic. The idea that, and it's not just countries and different kinds of medical professionals, but it's private companies or pharmaceutical companies partnering with the government, in this case, certainly in the United States and around the world, where combined in a coordinated fashion to pick the 5 or 10 vaccines that look to be most promising, and then really putting a lot of effort around that. And we learned a few days ago that the University of Michigan is likely going to be a site for one of the vaccines, the one coming from England, from Oxford. And just seeing that planning process, the scale of it, is something that has never been seen. But it is encouraging. And could you apply some version of that to other vaccine development? Absolutely. So although the focus right now, rightfully, is on COVID-19, some of what we've learned could apply to things that are more routine.
In terms of planning these vaccine trials, you mentioned the Oxford University vaccine that Michigan will be joining in on the trial on soon. You mentioned all the planning that goes into this to manufacture this trial in a way that's going to be effective in teaching the medical community about the behavior of these vaccines, the efficacy of these vaccines. What does go into that planning? What variables are teams looking over as they are preparing to begin any phase of these trials and make sure that these vaccines are going to be effective and be safe down the line as well?
Yeah, thank you, Tyler. And safety is, of course, very important. And there's sort of immediate effects, and then there's longer term effects. And that's part of why it takes a little while to determine those endpoints. But with the phase 3 trials that people have heard about, this is where you really want to see disease prevention. So some of the thought behind this is making sure that not just that you're vaccinating a large number of people, but you need to vaccinate people that have enough risk that they're going to come in contact with COVID. Because to see a difference between, in this case, the placebo is one of the placebos that's been used as a meningitis vaccine versus the candidate COVID vaccine. And then to see in the two groups, is there a lower rate? But you're not going to see a difference if you're in a place where there's not enough COVID. And so it's a little bit of a double-edged sword. We certainly don't want to see a lot of COVID in Michigan, but since the economy has sort of reopened and reengaged, we have seen like this kind of rising water of cases. So, for example, one of the things I think a lot about are college students, and they would probably be a good audience to vaccinate in a trial, of course, if they were interested, and with all the usual safety measures, because their behavior puts them at higher risk than someone who maybe is staying home all the time. Healthcare workers, essential workers. But it is also important to make sure that we do these studies in large numbers of people who are older to see how it works in older adults, since they are some of the highest risk groups for poor outcomes.
There's been so much confusion surrounding COVID-19 and the steps that need to be taken. And, is the government going too far? Are they not going far enough? As someone who is an expert, what is your take on it? Are we doing enough, or should we be doing more?
Yeah, so there is a lot of confusion, and it's understandable. This is coming at us 24 hours a day, and it has been since January. People maybe started paying more attention late February, March, but we're sort of at the point of exhaustion with COVID-19. In terms of taking steps, the public health measures are important at the individual level, but really at the the level of the population and the economy. And I'm most familiar with what's happened in Michigan, and I will say that I'm very proud of the steps that our state has taken and that Michiganders have taken to help support it. In particular, one thing we have learned, and this wasn't something we knew at the beginning, is that the benefit of masks is tremendous. And as we think about getting back to school, masks are going to be part of our uniform. They're going to just be part of what we do when we leave our home and we're not by ourselves. So I would say that the approach has really varied state to state. In some ways, the U.S. is sort of like 50 countries when it comes to COVID response. And some states have done better than others in terms of just shoring up all of the different public health resources and different rules. But I would say that Michigan has done a really good job, and that when you don't have clear advice on this, and in this case, masks is a good example, because it's hard to institute limits on everything. There are some limits on the number of people that can gather, of course, but this is something that you see a difference within the matter of days and weeks, and we are starting to see that here. Our numbers have they've stayed about the same, and they're not going a lot higher, but we still worry that if people can't keep to those general principles around watching our distance, wearing masks, washing our hands, that we could see an upsurge and be back to where we were in March.
Well, we definitely don't want that. Testing is another area of confusion. What tests should you get? Who should get the test? And how accurate are they?
So this is a great question. I'll try to give a very quick overview because this could take a long time otherwise. So in general, there are a couple different kinds of tests that people might hear about. One is a test for the virus or a test for infection. The other test is an antibody test, sometimes called a serology test, which looks for past infection. And there are a couple different buckets of people that we think about testing. One is those who have symptoms. So you have a cough, you have a fever, or you came into contact with someone who had a documented COVID-19 infection. Those are individuals that I put in a bucket of needing a test. And the types of tests might be a little different at each place. The turnaround time might be different. This has been something that has gotten a lot of attention. In the clinical setting, we really need rapid turnaround. And some places like Michigan Medicine do have rapid turnaround. If the test is done off-site or it's sent away, it might take a few days. Probably average is 2 days, maybe 3 days. We're certainly hearing about cases around the country where it's taken 7, 8 days to get a result. And frankly, it's not that helpful at that time. So that turnaround time is essential. And that's something that states need to really work on for the safety of their state. The other bucket of people are those with no symptoms and whether they should be tested. And there are certain buckets of individuals, certain jobs where people are being tested. And this is the one that comes to mind is people working in nursing homes are being tested. And this is part of a newer approach that we didn't have a few months ago. But this is to protect people who are very, very vulnerable. A lot of schools and colleges are looking at how they're going to test people with minimal symptoms or no symptoms to sort of make sure that you're not having widespread infection and not be aware of it. And again, those kind of tests could be a little bit different. Ronnie, you asked about how good the tests are. One thing to keep in mind is that the way the test is done really matters. So the test that probably you've seen on TV where it's called a nasopharyngeal swab, and it requires a medical professional to do that because you have to really go pretty far back into the nasopharynx and through the nose. The other tests might just be collecting saliva, but making sure it's collected properly. Some of the newer approaches are something called an oral swab, where you take a swab and you go into the mouth and take saliva. This is really important that it's done correctly and the right amount of saliva is collected. So there are all kinds of things being done to try to improve the collection. And then some tests are not as sensitive. They're not going to be as likely to pick up a positive. And if you're doing screening of people without symptoms, that might be okay, especially if you're doing thousands of people. But where it's not okay is when you're thinking about someone who is ill with symptoms. You really need a highly accurate test in that setting. And the good news is, as testing is becoming more available, it's becoming more convenient, but we're still not where we need to be. And so I'm looking forward to more progress in the coming weeks.
Dr. Preeti Malani with us. She is the Chief Health Officer and Professor of Medicine in the Infectious Diseases Division at the University of Michigan, with us on the Oakland County MegaCast. Dr. Malani, as we are approaching returning kids to school in a couple of weeks, there's been some requirements in the last couple of weeks for summer school classes, particularly the court-ordered ruling in the Detroit Public School District that all students that were going to continue with their summer school courses, in order to do so, had to be tested for COVID-19. In your opinion, as we're returning kids to school, is it worthwhile? Is it smart? Should it be done where we have kids be tested or teachers be tested consistently for COVID-19 to ensure that they are going to school healthy for in-person learning?
Yeah, so this is a difficult question, and I'm going to say it depends. It depends on the setting. There are some settings where social distancing can't happen, and if you can have some sort of test where the turnaround time is rapid, where it's convenient to do, where the cost is manageable, certainly testing would be helpful. But it's very difficult at this moment, and this could change in weeks and months from now, to really be able to do consistent testing. What I don't feel is necessarily very helpful is requiring everybody to go get tested 2 weeks before starting school. And I know that some schools are asking for that. I'm not sure what that's based on, but again, that risk it's not a one-time risk. It is different if you're moving into a boarding school, for example, where you're coming into a community and then you're not going to really leave that community. It's going to be a little bit more enclosed. And the example I'll point to is what's happening in professional sports, where there's testing all the time of people, and they're finding positives, and they're removing them, and they're finding that it has spread to other members of the team. And classrooms are kind of like a team. And depending on the kids and their ability to socially distance and wash their hands, it can be difficult. Testing could be part of the approach, but we need to be aware of what testing does and doesn't do. And just like for adults who are out and about, face coverings are important in the school setting. And again, it could be a little bit more difficult, especially in young kids, to be able to have them do that. But there are ways to encourage good mask use and to provide some breaks for the kids to be able to remove their masks safely also.
Dr. Malani, on the question of testing and the timing of testing, with the delays that we are seeing from many labs in the state of Michigan that have caused delays in some COVID-19 case results being reported by the state, I have a question of who should go get a test. If someone's curious, should they get a test, or should they wait until the systems at B are a little less backlogged? Or should anybody that is curious or definitely if they're feeling symptoms, go get a test?
So the second part of your question is the easy one. If you have symptoms, absolutely you should go and get tested. And there are resources on the Michigan Department of Health and Human Services website, COVID-19 page, to help make sure that you can get somewhere to be tested. A lot of the health systems also have that information to be tested in a safe and convenient way. Even mild symptoms, I would say, if you've had an exposure, that's another reason to think about being tested. And again, it's a little bit case by case. At this point, I would not recommend that people that are asymptomatic on large scale be tested, unless they're going to be maybe going back to school or going back to college. And again, it really depends on the scenario. And your point is well taken. It is for some of these tests, these are also used in the clinical setting. And although we're kind of in an okay situation right now in Michigan, what one of my colleagues calls it is sort of the rising water. And the water's rising, but it's rising slowly. We do worry that we could get into a situation that we are not able to support the testing that's needed for the clinical setting, or if there's a big exposure in one, like a workplace or a nursing home or a school. You want to make sure that we have enough supplies. So just curious, not sure, probably could wait.
Dr.
Especially if you're practicing socially distance. You're practicing all the other things that need to go into our everyday lives.
Dr. Malani, just another minute or two with you before we have to let you go. Any other important information that our audience should know at this point in time as we continue to battle COVID-19?
One of the big things is we're so focused on COVID-19, and it is the primary issue. But I say this as a parent. We do need to think about our kids' well-being and our own well-being. And what I've really asked people to do is try to reframe our social interactions right now to think about what we can do instead of what we can't do. I've shared this information with friends, family. Like have a couple people over, meet outside, have that interaction. Do it in a way that's safe, that provides social distancing. We're not in a situation where we can have 100 people in our backyard safely, but think about what we can do. And I would say the same applies to kids, because being connected to each other is also really important. And the masks do offer quite a bit of safety. So, it's going to be part of our life for the time being, for the, as at least a foreseeable future, but really focus on what we can do instead of all the things we can't.
One last question for you. When you say, it's okay to be outside, there's less of the chance of a spread when you're outside. I really thought we'd see much more of an uptick with all of the protests going on, because you are having large groups gather. Why is it not spreading through that group of people, do you think?
Yeah, this is a good question. And, part of it is that maybe not everyone who went to protest got tested. So there could be that people had mild infection. There were recommendations in some places to please go get tested. It may be that at least the peak protests in Michigan sort of happened at a time, this was early June, late May, that we weren't seeing as much, we weren't seeing as many cases, so that might have contributed. The other thing is a lot of people were wearing masks and trying to socially distance. There were all kinds of different protests. Like protests, what we see on TV isn't really what was happening in a lot of spaces where people were spread out. They were practicing good hand hygiene and all those things. So it may be that we weren't seeing transmission. And, as you know, Ronnie, like it is harder to transmit outside. It's not impossible. And we're certainly seeing that, but it tends to be close contact, no masks for an extended period of time. Some of the protests around the country, the places that they saw spread was in the after parties, which occurred indoors. So again, no activity is fully safe. We can make it safer. And all of us share risk, and we all share responsibility.
Dr. Malani, thank you very much for being with us today. We appreciate it. Dr. Preeti Malani from the University of Michigan with us on the Oakland County MegaCast.